do. All right, good morning and welcome. We have today our current event is Dental Assistant, and we have Renee, and she is the instructor at PCC for Dental Assistant. We'll learn her career and how to get into Dental Assistant at PCC. But before that, let's do a little housekeeping. First, we'll do make sure you check in. That's how your teacher knows that you are in this event and not anywhere else. If you have questions and you don't know how to formulate it, we have a great questions that you can reference to. And please do the evaluation form right after the event. This is for us and your teacher to grade you on this event, and it is required for your graduation in high school. And let's see, we also, if you can do the QR code, we have the link and it will be on the chat also, so you can just click on it. And let's give it to Renee to share.
All right. Hi, everyone. Welcome. Thanks for having me. I'm going to go ahead and share a presentation with you now. So give me just a second here. All right. Are you guys able to see that?
Yes.
Awesome. Thank you so much. Well, my name is Renee and I am from Portland Community College, and I am a full-time instructor in the dental assisting program. I'll tell you a little bit about myself. I have been a full-time instructor here at PCC for a little over 3 years. Before that, I was a part-time instructor. I got a bachelor's degree in art and then decided I wanted a better career option. And so I ended up at PCC in the dental assisting program. And I graduated from PCC's dental assisting program back in 2007. And then I worked as a dental assistant for about 7 years. I went back to school at PCC and I went through their dental hygiene program. So I'm also a dental hygienist, but I always knew that I wanted to teach, and I loved my time at PCC, and I always knew I wanted to come back. And so now I'm here and I can't imagine doing anything else. I just absolutely love teaching. I am very, very passionate about dental assisting. So I'm really happy to talk to you guys. I'm so sad that we have to do all of this over Zoom. Usually we love having students come into our building and get you to do some hands-on experience as well. So hopefully in the future, we can get back to that. And hopefully some of you guys actually want to come into our program, and that would be great because then we can get you that experience. So I'd love to take some time and talk to you a little bit about our program, as well as kind of what being a dental assistant means, so that you can see if this is something that you are interested in. So we have a team of 4 people in our dental assisting program. Peggy Llewellyn, she's on the far left on this slide. She is our lead instructor, and she does all of our clinical courses, as well as some other things. And then there's me, Renee, and my focus is mainly on dental materials, lab courses, as well as some other things. Sandy Crawshaw is our dental radiology or x-ray instructor. And then we have a new instructor named Rochelle, and she focuses on our new part-time dental assisting program, which I will talk to you guys about in a few slides. But there's the 4 of us, and we all work together to support you and advise you while you are in the program. So if you decide to come on board, these are the people you will be with. So what is a dental assistant? Dental assistants are really, if you talk to anyone in the profession, they're really the heart of a dental office. They work with the dentist to help patients receive care. So typically this is the person that's sitting right next to the dentist, you know, handing them instruments and materials, talking to the patient, and making sure that everything is going well. The dental assistant's work provides a large variety of duties in the office. It's something that is never boring. There is never a dull moment. You are on your feet a lot. Well, you're sitting too, because you just have to sit with the patient. But you're basically, your activities change quite a bit. So if you're the type of person that likes variety in your day and likes to stay busy, this is an awesome career choice for you. Before I was a dental assistant, I worked as an administrative assistant, or basically a secretary, for a while, and I hated my job. And so, for some people, that's a great job, but I just couldn't stand just sitting all day. I really need to be busy and doing things. And so once I became a dental assistant, I just knew it was the right path for me, because I just got to be busy and my tasks were changing all the time. So it was really mentally stimulating for me. So that's something to really think about when you're choosing a career path. But dental assistants do lots of things. Not only do they sit with the dentist, but they actually can provide some direct patient care. There are certain things that dental assistants can do without the supervision of a dentist right next to them. So you can actually do some things independently. Dental assistants take x-rays on patients. They can also do record keeping or chart notes, as well as scheduling appointments. So some administrative or computer work as well. And that really just varies on the type of office that you work in and that type of environment. But it is a very varied career. And so lots to keep you busy. So how do you become a dental assistant? Well, the PCC program, we have two programs currently. We have our traditional, what we call full-time or 9-month program. And then we have our new part-time program, which has just completed their first, we just completed our first cycle with that program. So I want to first tell you about just our traditional full-time program. So this is a 9-month program, which is 3 terms. So this program goes from fall, winter, and spring term. So you start in the fall, graduate in the spring, and you get a 1-year certificate when you graduate from this program. We prepare you through your classes to take your national board exams to become a dental assistant. And you can do even more as a dental assistant by becoming what's called a certified expanded functions dental assistant. And this is a certificate that you automatically get when you complete our program at PCC. There are some programs that are not accredited, and those programs typically don't award you this certificate. But when you graduate from PCC, you basically have everything that you could possibly need or want to do as a dental assistant. And we fully prepare you to get all of those things. You do need to have some previous college experience, which I think, depending on your school, you may be able to get those through high school. You need to have Math 20 or an equivalent placement score, Writing 115 or an equivalent placement score, a nutrition elective, as well as a psychology elective. There's a course called MP 111, which is medical terminology, which we've actually changed the prerequisites on that. So we want you to have that before you come in, but if you don't, we are allowing you to take that in your first term during your time at PCC. And then you also have to have 12 hours of job shadowing a dental assistant. And the reason that we have you job shadow is because obviously, with any career, there is a right fit for everyone. And by shadowing somebody in the profession, it really gives you an opportunity to know, is this the right career for me? Because just shadowing can tell you, like, wow, this looks like something I'm really interested in, or maybe, there's just things about this that didn't seem like something I would like. And so by job shadowing, you really get to get that experience. So that's some of the stuff about the program and kind of how you can get in. And then what will you actually be doing once you are in the program? Well, with the full-time program, again, it's 3 terms long. So during the fall term, you're here full-time, and the big focus is on lectures as well as clinical learning and really gaining a foundation for the rest of the program. Fall term is pretty rigorous, so there's a lot of new stuff to learn, and it's just because it's new. You have to learn dental anatomy, you have to learn the basics of radiography. It's a lot of new information for you. And during that first term, you'll rotate through 3 different labs during the week. And so you'll spend 1 day in the dental clinic working on clinical skills. You'll spend 1 day in the radiology lab taking x-rays and working on those skills. And then you spend a day in the dental materials lab, and that is learning about the different dental materials that you will mainly use while you're in the clinical setting, but we just do it in a separate lab. And so that's kind of the focus of the fall term. And then once you get into winter term, things kind of lighten up as far as lectures go. You still have some lecture courses, but we're really just building on the things that you learned during the fall term. So you're a lot more comfortable with things. You know your dental terminology. You're more comfortable in the clinical setting. And then what we do is we also have you spend 1 day a week up at OHSU working with the dental students. So you're actually doing some additional chairs, what we call chairside experience, actually sitting with the dental students and getting to assist them and help them up at OHSU. And our students, I've never ever had a student that says they did not like that experience. Usually our students love being up at OHSU. They have a beautiful school and campus up there. The dental students are wonderful to work with, and it's a very slow-paced environment, which is good for students to learn in. And so that's kind of where we get you to winter term. And then spring term, we kind of up the ante a little bit, and you're actually out at an externship 3 days a week. So you spend 3 days a week in a dental office, actually just basically being an assistant. You're still learning, and there are some school objectives that you have to complete while you're there, but you're basically just a member of the dental team in that office, and really learning the hands-on skills that you need for when you graduate. You do have a few classes spring term at PCC, but it's a much lighter load, and you're coming to our campus much less, and you're spending a lot of time out in your office actually doing real dental assisting work. And while you're at PCC, you will definitely make lots of job connections. You will meet lots of people in the profession and have lots of opportunities to make those job connections. Most of our students, they really keep in touch with each other throughout the years and stay friends. And I'm friends with a lot of past students on Facebook, and they're friends with each other, and we get to kind of keep in touch, which is really nice to have those long-term friendships and connections. And then we also give you some opportunities to do some community outreach while you're in the program. So working with, we give you options to do like elementary schools, working in senior living facilities, just lots of different options for doing some community outreach as well. So it's a busy 9 months, but I think it's a very rewarding 9 months, and we really try to get you prepared so that you're confident and ready to go once you graduate and get out into the world. And most of our students, actually, because dental assisting is a very high demand career right now, most of our students get hired right after their externship. So they actually get hired into the office where they do that spring externship, because offices are really love our students, and typically we try to match you with an office that's a really good fit for you, something close to home. And so we have a very high rate of students being hired from their externships, which is really nice. And so then we also have, like I said, our new part-time / online dental assisting program. And this is something we just started last year. Our first cohort or group of students is graduating this term, so they're just finishing up. But the part-time program allows you to earn the same 1-year certificate and prepare you exactly the same way for your national board exams, but it allows you a little bit more flexibility, basically, to work while you get your education. So we stretch the program out from 3 terms into 4 terms, so you take a little bit less class each term. So that gives you a little bit of extra time to work and do other things. And then all of your lecture courses are online. So that means that although there are due dates associated with your lecture courses and things that need to be completed, there's a lot of flexibility throughout the week. So, assignments will be assigned on Monday and they're not due until the next Monday. So there's no set time for you to be in a lecture or to do certain things. If you wanted to do things at 11 a.m. in the morning, you could. If you wanted to do things at 11 p.m., you could. So it's a very flexible solution to people who maybe want to or need to be working while they're getting their education. And this is a really excellent option for some students. However, the big kind of caveat or warning to this is that it does require a pretty high level of self-discipline if you want to be successful in it. Because since it's mostly online, it means that you have to really have some dedication to giving yourself the information, because no one's going to be there to kind of hold your hand through it. We're going to give you the information, and then it's your job to really work through it and absorb it and make sure that you know it so that you're prepared when you come in for some clinical rotations on campus. But again, it's a really good opportunity for some students. So that's a good thing to think about. And I know that our current class of students that's going to be graduating have been really successful, and it's just been a great experience for them and for us at PCC, kind of starting out this new idea of the part-time online program. So we've got the kind of the two options. And so how do you know if dental assisting is a good fit for you? You definitely have to have good communication skills. You are the person who is calling the patient back, seating them, talking to them about their appointment or their procedures, answering questions for them. You'll be the person relaying information back and forth to the dentist. You should definitely enjoy working with your hands as well as your mind. So there's a lot of fine motor skills involved in dental assisting. When you're working with the dentist, there's a lot of small things that you're needing to pass. You will be having to do things in a patient's mouth. So being able to work in that small environment with your hands is a really critical skill. You should definitely want a career with responsibility. Being a dental assistant does come with a lot of responsibility. There's a lot of different tasks and things to manage while you're in an office. You should have good technical or computer skills. I think with most jobs nowadays, we all have to be good with computers, and most dental offices are completely electronic now. So being able to learn those skills quickly is a good thing to know. A willingness to learn. Things are always changing in dentistry and evolving, and so being able to kind of keep up with those changes is good. Able to work in a fast-paced environment. Dental offices are very fast-paced and things do move very quickly. And so that's a really good option for some people. Like, I really enjoy working in a fast-paced environment, but that may not be the right choice for you. So that's something to consider. Definitely being a good team player. A dental office is 100% a team, and you have to be able to work with each other and help each other. So being a team player is critical. And then being able to take ownership of your work and show initiative. In a dental office, a dentist will typically expect you to kind of take your own initiative to get things done. They won't always tell you what needs to happen. Of course, you know, they'll help you learn what you need to do, but then once you know how things flow in an office, you're kind of expected to just show initiative and then take ownership for your tasks. So these are things that are skills that a dental assistant would definitely need to have. And if these are some things that really resonate with you, then this definitely would be a career to think about. So people always want to know, what is the job outlook for a dental assistant? Is this a good, stable career? Absolutely. This is such a high demand career right now. It's growing rapidly. I get emails every day from dental offices saying that they're looking to hire our students. Do we know anyone? And I see messages on Facebook all the time from dental friends trying to find dental assistants. So this is definitely a stable career. You're definitely able to make a living wage, and that wage is going up pretty rapidly. The dental assisting profession is expected to grow 19% over the next 10 years, which is faster than average for most careers. There's predicted shortage of 58,000 dental assistants nationwide by 2024. So that's a pretty big shortage. So that obviously shows that there's a big demand for it. And especially in the Portland metro area, we have noticed that the demand is very, very high right now. And when we talk to community members in the profession, they are telling us that same thing. And there's a lot of opportunities to find the right office for you because it's such a, this career is in such high demand. It's not like when you graduate, you're really having to search for a job. Those opportunities are basically just laid out in front of you. So you can really find an office that's a right fit for you because there's a lot of different, we always say that dental offices each have a personality, and you have to find the personality that fits best with you and the team that you're going to work well with. And so you really have that opportunity right now to find what will work for you and what fits for you. So the question everyone wants to know is, how much do dental assistants make? Well, the salary does vary. It depends on where you live as well as what your responsibilities are in the dental office. Portland metro area is fairly high, being a city. Dental assistants earn salaries that are equal to other healthcare personnel with similar training and experience, so such as medical assistants, physical therapy assistants, occupational therapy assistants, vet techs, as well as pharmacy assistants. And dental assistants in the Portland metro area right now are making up to $28 an hour, which is pretty good. It definitely can start lower than that when you're first starting out, but it's very competitive right now. And especially a lot of the group practices like Kaiser Permanente, Willamette Dental, most of them are offering pretty large sign-on bonuses for assistants right now, just because they really need assistance. So not only are they upping their wages to be competitive, but they're offering those sign-on bonuses as well. So again, it's the benefit is to the dental assistant right now, and they have lots of options as far as finding a good fit and good pay. So if you are thinking about pursuing dental assisting, I have some things that some of our past graduates have said. Don't be afraid to get out of your comfort zone. So definitely our program, it's pretty rigorous, but it's also a lot of fun. But you should be able to, kind of just, get yourself out of your comfort zone a little bit, be able to experience some new things. It can be very intense. Definitely take the time, if this is something you're interested in, to shadow a dental assistant and just make sure this looks like a career that's right for you. At the end, it is so amazing knowing you have someone else to share a dream you've accomplished. Help each other out and be there for one another. So you get to know your future colleagues in the program, and that's a really valuable experience. You'll definitely make friends that will last. They'll help you get through your classes, but you can also connect with them for jobs after graduation. A lot of our students or graduates will end up working in the same offices as each other, which is a lot of fun. And even our students that are in their externships, sometimes they get placed together. And so that's a really nice experience to be able to kind of bounce things off of each other. So it's a really good way to meet people and stay connected as well. All right, so I do have a little video for you guys. Let me see if I can share that. There it is. Okay, so let's see. Stop me when I start this. Stop me if you guys can't hear it.
I'm passionate about being a dental assistant because I feel like we actually do make a change in this industry. We're helping people.
I really feel at the end of my day that I did something good.
I'm passionate about dental assisting because I love helping people and knowing that I made a difference. It's not a one-person job. The office works when everybody's working together.
70% of the dental team are dental assistants.
A dental assistant is basically the backbone and the co-star to any patient experience at a dental practice.
It's my job to help make the patient feel comfortable from start to finish.
The dental assistant is a crucial part of a practice.
It's always something new. It's never the same thing over and over again.
Every day is completely different from the one before. I get a lot of variety.
Any given day could be a different experience.
1 hour you could be doing a filling, the next hour you could be cleaning teeth on a child, and the next hour after that you could be placing a dental implant with the dentist.
As a dental assistant, there's endless opportunities of growth and variety in what I get to do.
We love the PCC graduates because they are ready to go.
I chose PCC Dental Assistant Program because of the credentials that I would leave with.
PCC graduates graduate with an EFTA, so Expanded Function Dental Assistant credential. So one of the things that they're definitely able to do is just hit the ground running.
That lets you do so many more things chairside with the dentist, including making temporary crowns, placing temporary fillings.
You get your ortho certificate with it. They make sure that you're ready by the time you graduate from the program for real life dental assisting.
They get more experience coming out of school, they get more certifications, and they have more confidence.
By the time that I finished, I felt extremely prepared for the field itself.
I walked out of there with so much knowledge that I knew I could do the job.
So it's a well-balanced course, and the professors were really helpful, and they're in the dental field, so they know what's going on and how we feel.
They really help between externships and internships and resume building to make sure that you're successful as soon as you leave their building.
I feel like with PCC, they're just not about like getting patients and getting students in and out as soon as possible. They actually do care about the students.
As a dental assistant, I know that Portland Community College gave me all the skills and knowledge that I needed to be the best dental assistant I could be.
If you're a PCC graduate, you're pretty much guaranteed a job.
People want dental assistants from PCC.
I've had a wonderful career in dental assisting, and I owe it all to my experience and knowledge that I gained at Portland Community College.
All right, let me go ahead and stop sharing that. All right, so I guess that's really all I have to present, and I'm just, if anybody has any questions, I would love to answer them, and yeah.
So we have some questions on the chat. Why the Evergreen Middle School is asking, why is the field growing so rapidly?
Well, let's see. Why do we think it's growing so rapidly? I think that there's definitely a need for more dentists in the community. I don't know whether that's because of population growth or what, but we need more dentists. So more offices are opening, bigger group practices are expanding. And when that happens, then we need more dental assistants. We also have a lot of people that are older that are in the profession that are retiring, and that's leaving a pretty big gap for the profession as well. I think another thing that's contributing to it is that in the past, I would say probably about 10 years ago or so, dental assistants were not paid as well as they are now. And I think people were just not choosing that as a career. They were choosing other careers where they could make more money or do different things. And now people are really recognizing the value of dental assistants. And so the wages are going up. There's a little bit more respect for the profession, and dental assistants are also able to do more things than they used to be able to do in the past. And so I think that's really increased the need, not only the need for them, but also people's interest in going into the profession too.
And another question is, what high school courses have you found to be most applicable or important for your occupation?
Oh, that's interesting. I think any courses where you need to have good communication skills are probably critical. So anything where you're having to communicate with other people, definitely computer classes are probably helpful. Science classes, things where you're learning about basic anatomy, will definitely give you, even though it's not necessarily dental anatomy, it gives you kind of that foundational knowledge of anatomy that will help you once you get into the program. So those would be some of kind of the basic classes.
And when you were showing your first slide, what was that letters represent in your last name? There were a lot.
I do have a lot of letters. I think once you earn some of those letters, you really want to promote them on your stuff a little bit. Let me see. Let me remind myself what exactly is behind my name. I'll tell you what those are. Okay. So the letters behind my name, I have quite a few. So RDH is a registered dental hygienist. So like I said, I did graduate from PCC's dental hygiene program. So I have a license to practice dental hygiene. An EPDH is an expanded practice dental hygienist. So in graduating from PCC's dental hygiene program, I was eligible to be an expanded practice dental hygienist, and that's an additional certification on my license that I pay for. And that just means that basically I am able to go out into the community and do more things than just a regular dental hygienist would. I don't really utilize that very much, but it's a nice thing to have on your license. I just think, why not have it? A CDA, when we're talking about dental assisting, a CDA is a certified dental assistant. So being a certified dental assistant is not something that is required in Oregon. Basically, what it means is that you have to take one additional board exam in order to get your CDA. And I feel, and I think my colleagues at PCC, we would all tell you, it's always nice to have all the certifications you can get. So it just shows that you have a little bit of extra dedication to the profession of dental assisting and that you're willing to get that extra certification and take that extra test. And so that's something that you get a certificate for, and it's something that you have to maintain, similar to like a dental hygiene or a dental license. So it's something that has to be maintained throughout the years. An EFDA, or we call it an EFTA, that's Expanded Functions Dental Assistant. And so you graduate with that when you graduate from PCC. And what that is that basically anyone could be a dental assistant. You could go into a dental office, they could hire you off the street, and you could sit next to a patient and you could do certain things by law. However, there are some things that quite a few things you cannot do by law, but by getting your Expanded Functions Dental Assisting Certificate or your EFTA, you're allowed to do a lot more things than you would if you didn't have it. And any office that you try to get a job at, they will not hire you if you don't have your Expanded Functions Dental Assisting Certificate. They want you to have that because they want to utilize you to the max of your profession. And so again, you would get that by graduating from PCC. And that allows you to do these expanded functions. Similar to that is what's called the FOTA, which is the Expanded Functions Orthodontic Dental Assistant Certificate. You also get that by going through PCC. And that means that you are an Expanded Functions Orthodontic Dental Assistant. So orthodontics, if you don't know, is braces. So there are special dental offices that just focus on braces and straightening people's teeth and dealing with different ways that the jaw maybe there's like a discrepancy in how people's jaw is aligned. And so those offices, you don't have to have this certificate to work there, but it just is really helpful, and most offices will want you to have it. And so it just prepares you to work in an orthodontic office if that's something you're interested in. And then the last two things on my list, a BFA is a Bachelor of Fine Arts. So I got my undergraduate's degree in fine arts and painting, which is far from dentistry, but I do think dentistry is definitely an art. So I think it comes in handy for me. And then lastly, I have what's called an MPS, which is a Master's of Professional Studies. And I have that in organizational leadership. And so, so I got my master's degree just a couple years ago, and I did that completely online. And so hopefully, I think I'm done. So hopefully no more letters coming, but that's what they all stand for. I know that was a lot.
What do you wish you knew but didn't when you first contemplated this career?
Ooh. I think two things. I'm going to first rephrase that and say one thing I wish I had known was I wish when I was a high school student, I wish I would have had opportunities like this. When I was in high school, where I went to high school, we did not have much guidance as far as careers that were available. I had a really limited knowledge of what was available as far as job opportunities. I thought the only thing that I could do was go to a four-year college, which is what I did. And my parents didn't guide me very well, and I ended up with an art degree, there's no problem with getting an art degree. But for me, I just really wish I had had more guidance and had paid more attention to some of the things like this and really thought about it, because I think I would have maybe made some different decisions when I was younger. But as far as things, now that I've gone through and I've been through this profession, what do I wish I would have known about it? I felt like there was a lot of pressure when I was in dental assisting school that if you're a dental assistant, you should be a dental hygienist or a dentist, that you really needed to just keep going, that this was just like the first step. And so for me, I went on and became a dental hygienist. But what I realized was that I actually did not like that very much. And again, there are different career paths for everyone. And I know a lot of hygienists that love being hygienists, but I loved being a dental assistant. It was just, I enjoyed my days a lot more. There was a lot more variety to the day. I had a lot more responsibility as far as different things throughout the office. And so that was something that really fit for me. And so I guess I wish I would have known that, how good of a career it was, instead of thinking that I needed to do something else or keep moving on and do something like that. And so just really like listening to myself and knowing what I wanted. But that's a great question.
So how did you kind of like decide like, okay, yeah, I really want to be in the dental kind of like career? Like how did it happen?
It's kind of a roundabout way. So again, I got my undergraduate degree in art, and I was working at Starbucks, and I was like, wow, I went to 4 years of college and I have all these student loans and I'm making minimum wage making coffee. Like this isn't really what I had planned. And so what happened is that my boyfriend at the time was coming, he was moving up to Oregon. He was going to go to Oregon State to get his master's degree. And I decided to go with him. And so I applied for a job at OSU. And so I got a job as an admin assistant. So I was just sitting at a desk. And again, I did not like that job. It was not for me. But while I was there, the office that I worked in was the College of Science at OHSU or OSU. And I worked really closely with the pre-medical and pre-dental advisors, because that's the office that I supported. And I became really close with the pre-dental advisor. Her name was Sherry. And I started talking to her about careers, and she let me sit on a class that she taught at the time, which was called Intro to Dental Professions. And she let me sit in on the class, and basically each week they would have someone come from the dental profession, whether it be a dentist, a hygienist, someone from like the Oregon Board of Dentistry, and they would just talk about the profession, talk about different things about it. And I just started to think, this seems like something I might be interested in. And on top of that, I was obviously looking at how much does this pay? What are the working hours? What kind of benefits are involved? Is this a stable career? And it was really ticking all of those boxes for me. And I thought, okay, these are things I want out of my life. I want a job with good benefits and good pay. I want to have a flexible schedule. And so I thought, well, I've already been through college. I had all the prerequisites, and I thought, I'm just going to apply to PCC's Dental Assisting Program. And it's only 9 months. PCC is not a super expensive school, and it's a community college. So I thought, let's give this a shot and see how it goes. And it really worked out in my favor in that I ended up just really loving it. I never, you would ask me 15 years ago if I thought I was going to end up in dentistry, I would have said, you're crazy. But I just absolutely love it. And I'm super passionate about it. And I think that's why I also love teaching it.
So how much does the dental assistant make?
So I would say right now, like straight out of school, dental assistants are probably making around $19 to $20 an hour straight out of school. And that does depend on where you work. If you are working in a private office, like if you driving down the street, you see like Dr. Smith's dental office, that's called the private office. So that's usually just 1 or 2 doctors, very small. If you work there, usually the wages are going to be on the higher end because they offer you less benefits. However, if you go to like a group practice, so something like Willamette Dental Group, Kaiser Permanente, Gentle Dental, those are what we call group practices, where they have lots of offices throughout maybe Oregon and Washington. Those offices may start you like $1 or $2 less, but the benefits are a lot higher. So they're offering you things like bonuses, better medical and dental coverage, retirement plans. If I know you guys are young, but if you're thinking about retirement, like Kaiser offers a pension plan, which is a really good thing if you know anything about retirement. So there's definitely some things to look at when it comes to wages. It's not always just the starting wage. There's those benefits to look at. And again, there's sign-on bonuses. So a sign-on bonus for what I've seen are usually around $1,000 to $2,000 sign-on bonuses for people right now in the Portland metro area. And wages typically go up pretty quickly. And again, this is a pretty high demand career right now. So I think if you can gain some skills, and I don't know if how much high schools prepare you as far as like job skills go, but like if you can gain confidence in being able to, you know, kind of negotiate like, hey, you know, if I'm being successful after 60 or 90 days, you know, can we raise my wage, you know, $1 or something like that? A lot of offices are doing things like that because again, they really need dental assistants. And so you as an employee, as a dental assistant, have a lot of power as far as kind of negotiating that wage, if that's something that you're kind of comfortable with.
And what are the soft skills that you think would be really helpful in the job?
Definitely communication is a must. I myself am actually, I would consider myself a pretty strong introvert. I'm not very outgoing. If I'm at a party, I'm usually the person in the corner, like petting the dog. I'm not very social, but yet I do feel like when it comes to dentistry, I have pretty good communication skills. You've definitely got to be able to be comfortable, you know, introducing yourself to people, patients in particular, talking to them, explaining things to them, answering questions, and just building up like a general rapport, you know, being able to have a conversation about their day, things like that. I would say that's really critical. We always say to our students that some people are going to be better at, you know, textbook skills and test taking than other people. That's not as important as having a good personality, you know, being able to talk to people, being able to relate to people and communicate. That's probably the biggest skill. You know, we can't really teach you that. That has to be something that you come with. Other soft skills, definitely a drive to learn, because you will be learning a lot of things. So being able to do that, and being a good team player, being able to get along with your coworkers, being able to get along with your classmates. This is not something that's just an individual doing a job. It's not just a person sitting at a computer focusing on their task. It's really, you have to be able to work with other people, communicate with them, help them, and you know, ask them for help when you need it as well. So being a good team player.
All right, thank you so much. If you have any more questions, please type it in the chat or just jump in. And if not, then we'll say thank you. Thank you so much. That's a lot of good information. And hopefully high school students can like go, you know, be part of the dental industry.
Yeah, no, it's definitely a great career. And if you guys do, I see that there's something that popped up in the chat, but if you guys have any questions, you know, you can feel free to direct students, you know, give them my email. They can reach out to me anytime. Come in, and we do allow students to shadow here at PCC as well. So you can come in and actually shadow in on the classes, which is really good too.
So we have more questions coming in. What
Sure.
is the difference between dental hygienist and dental assistant?
So basically a dental hygienist, so dental hygiene is a 2-year program. So it's 2 full years, including a summer. And then dental assisting is a 9-month program. If you do just our normal full-time program, it's 9 months. So it's longer. You are licensed by the state. Whereas the dental assistant, you get a certificate, but it's not something that's, it's not a license that you have to continue to renew. Dental hygienists do have more legal responsibility with patients, but I would say the biggest difference is that a dental hygienist is the person who works independently alone cleaning a patient's teeth. So they're the ones that are going to actually clean your teeth. You know, they scrape all the stuff off and then they polish them and teach you how to brush your teeth. Whereas a dental assistant is really the person that's assisting the dentist, as well as doing a million other things in the office.
And what was the most memorable event in the workplace?
Ooh, that's a great question. The most memorable event. I can think of a lot of funny things that happen with patients. If you enter the dental industry, you will share so many funny things about patients with your coworkers and other people in the industry, because funny stuff always happens. But honestly, when I really think about it, I think it's just when I was working I was working at a private practice. This was when I was a dental assistant. And I just loved my office so much. Like we had so much fun. We would have holiday parties. My boss would take us out to fun places and fun dinners. We would have fun in the office. We'd go out to happy hour. We just really enjoyed each other. And I think having that bond with those people, I mean, it was just, I found a really good fit with that office, which I always encourage, you know, my graduates to do, is find that right office. It's like a little family. And it's like, I just have so many good memories from that. And so it's really not so much about the patients or the dentistry, even though that was fun. It was really about that connection and that team, because I mean, you think about it, you're spending most of your life at your job, you know, you're spending hours a week at your job, you're spending your whole day there. It should be something that you enjoy, and it should be with people that you enjoy being with.
All right, thank you.
Yeah.
If you have any more questions? And if not, then we will stop the recording. And you can turn on your camera and say thank you to Renee.